Hi, welcome to this episode of Detroit Peds Talk. I'm Dr. Jamil Smith, lead integrated behavioral health pediatric psychologist at Wayne Pediatrics and clinical assistant professor in the School of Medicine at Wayne State University. And I'm really pleased today to welcome Dr. Elizabeth Secord. She's a board certified pediatric allergist and immunologist who specializes in a variety of allergic conditions and asthma concerns in children. Dr. Secord is also a founding member and director of Wayne Pediatrics, professor at Wayne State University School of Medicine, and a medical provider for the Horizons Project, a Wayne Pediatrics initiative focused on HIV and AIDS in youth. Welcome, Dr. Secord.
Hi.
This month we are recognizing asthma and increasing asthma awareness. And I've asked Dr. Secord to join us as an expert in this field. So Dr. Secord, what is asthma?
Asthma is an inflammatory condition or swelling, edema of the lungs that occurs sometimes after an allergy, after another insult. But what people feel is a tightening of the muscles. And in the old days, way back in the 40s and 50s, people just thought it was the tightening of the muscles. But now we realize that if you just treat the tightening of the muscles and don't treat the inflammation, then you get some chronic changes from it, and the asthma doesn't improve. So now we treat both.
Okay, very good. So, and then at Wayne Pediatrics, how do you support our patients who might be suffering with asthma?
Well, yeah, I see kids from mild to what we call persistent asthma. And so the good news is there are a lot more treatments now for asthma. The bad news is a lot of people don't know about them and don't come in for regular care. They only go in when they have attacks.
Yes.
So what we try to do is encourage people to stay in care and to try to, as we said, we escalate the medication for the kids and for adults too, so that they don't have to interfere with regular activities. So often parents will come to me and say, well, we keep her out of, or we keep him out of sports. No, we don't do that. We try, you treat the asthma so that the patient, the child or the adult, can do whatever normal activities everyone else is doing. We try to change the environment if we can, if it's indoor things. Often if it's outdoor things, again, I'll hear from people, oh, all spring and during the fall, we keep them indoors. No, we live in Michigan. We only have a short, nice weather period.
Yeah.
So we try to treat those allergies, if that's what's causing the asthma, and to keep it under control so that things can, so that kids can be kids. Kids have to have a life. They need a life.
Mm-hmm. I think that what you're talking about is so important. It's important for kids to be able to experience, normal kinds of activities if they can, and getting outside and getting exercise, particularly because we're so concerned about obesity. Sometimes in young people, it's very critical. So I think that's a very helpful reminder to parents that we want to manage the asthma so that they can do the activities that are good for them.
And be with other kids so that, like a lot of socialization is around playing kickball do people do kickball anymore? I think so. But baseball or whatever, they play sports outside, and you want to be able to go outside, do activities with the other kids. And, exercise not only keeps your weight down, which is one thing, but it improves mood. Everyone saw there was one study that exercise doesn't improve your mood. That didn't improve my mood reading that study, but I think there are a lot of other studies that show that it does help with depression and does improve mood. So, kids need to be outside and kicking up some dirt, and we need to take care of them so they can.
Yeah, absolutely. What are some unique factors that you see in treating asthma here in the Detroit population, working with families and patients from the
So
area?
Detroit is one of the highest asthma population cities. So there's more severe asthma in Detroit. And there are a few other cities in the US the same. Some of it is linked to housing, old housing. Some of it is linked to environmental toxins that may have been left over from old factories and such. Um, some of that you can't, it depends where you live. If you live next to where there used to be um, a car factory and there's still a lot of pollution there, you may have more risk of having asthma. Who has the lowest risk? Oddly, I was just talking to a group of school children about this, and someone brought up the farm thing. It's not all allergies. People who live on farms have the lowest incidence of allergies and asthma. So maybe we should all like grow some more plants in the backyard and have a cow. I don't think you can really get a cow in everyone's yard, maybe a goat, but people who live with farm animals and have a barn have lower incidence of allergies and asthma. So there's something about living in the environment and that is healthier.
Absolutely. Well, we certainly, appreciate some of this information as parents think about supporting their children with asthma. Um, just what are some unique things that you think that parents might experience in managing asthma and coming to Wayne Pediatrics?
Well, asthma is scary. So I think that the fact that we're always available. So if your child's starting to have an attack, it's better to call fast. I always tell families, and um, people don't always take advantage, but I'm always available. We have an answering service. You can always get hold of one of us to help guide you through the steps. I think it's important, and we try to practice keeping the medications at home that you might need to nip that attack. And then, I can't overemphasize keeping your regular visits so that we can do spirometry and see how the lungs are doing, and then try, if we know that your child gets bad in the fall, it's really important to come in before that and get everything tuned up and make sure you have all the medicines. This has nothing to do with the parents. It has to do with the way the system is set up. But if you're running out of meds, or you're having trouble getting them, or the pharmacy didn't dispense what you thought you were prescribed, which happens way more than we like to admit, happens to all of us. But to be very aware, if that happens, listen, I'm around, call, and I'll try and guide you through that, because we need to make sure that the kids have everything they need. And then if things aren't what they should be, if the asthma is very severe, then we would escalate and use the newer meds that are available now. Sometimes kids get allergy shots. They don't like to hear the word shots, but after they've been doing it for a few weeks and it doesn't bother them so much, tiny, tiny needle. But we build up a tolerance to things they're allergic to, and it can make people's lives much easier. And we offer all of that here.
Absolutely. Very good. So for more information about asthma and allergy treatment, or more information about Wayne Pediatrics, please visit our website, waynepediatrics.org, for more information. I'd like to thank Dr. Elizabeth Secord for joining us today and teaching us about asthma and how Wayne Pediatrics can help keep our kids safe. Also, follow us on Instagram and Facebook and YouTube for new Peds Talk episodes, posting every first Wednesday of the month. And remember, pediatricians are the best option for the medical needs of children. Take care.
See you, Dr. Smith. Thanks.
Very good. All right.